All right. Hi, Anita. I'm Lindsay. I'm going to be your nurse today, and the doctor has ordered insert for a Foley catheter. So I perform hand hygiene. I'm going to put on some gloves. We're going to verify your name, date of birth, and allergies. Do you have any allergies, especially to latex or iodine? Oh, you have a latex allergy? Okay, well, good. I brought a silicone latex-free catheter, so that's the one we will use for insertion. So please tell me your name and date of birth. Anita Williams, 1/15/1948. Yep, that matches my orders in my MAR and my computer. Allergies, you do have your allergy band on. Good. All right, so first we're going to perform peri-care, and we'll get you nice and cleaned up. And then I'm going to have my assistant come in, and she's going to help position you and get you ready for insertion. Do you have any questions for me? Okay, Foley insertion, what it is a little tube that goes into your urethra to help drain your urine because you're having some urine retention, and we need to get that out to help relieve your discomfort. Okay, yeah, it shouldn't be too painful. You'll feel us down there, maybe a little bit of pressure, but it should not be painful. If you feel any discomfort, let me know. All right, so we're going to go ahead and keep you warm. Put your blankets up top here. I've removed any jewelry, stethoscope. I put my hair up so doesn't get in my sterile field. This is a sterile procedure. I'm going to use good body mechanics and raise the bed. We'll get your legs bent and perform some peri-care before we get situated here. All right, we'll cover you up while we get our sterile field ready. I'll raise you a little bit higher. So you're at waist level. Clean off my table and let it dry. We're going to go ahead and lay your head back just a little bit here. It'll be easier for insertion. You doing okay? Go ahead and inspect my Foley kit. Make sure there's no holes, there's no liquid. It's intact. Silicone 14 French. Go ahead and get my patient ready before I open my sterile kit. Fold it up there. Come around. Make sure it folds back up. Remember, you got your 1-inch border. To work with. All right, my patient is alert and oriented and can follow commands. So Anita, I just need you to hold your legs still for me and not move them during this procedure. All right, thank you. Move my kit. And my gloves. Just gonna use this as a catch-all. Shiny side down. Protect her bed. Dominant hand first. Hand up. Take 2 fingers here. There we go. All right. All right. Make sure I stay within my 1-inch border. Have my sticks here. I cannot use those on the mannequin though. they look like. They're pre-soaked. Do you care to spray some lube for Annie in here? Cannot use that lube on Annie, so I'll throw that out. Make sure catheter, take the plastic tip off my catheter. Make sure I control that from flying everywhere. All right, now I'm gonna go ahead and lose my hands, clean off my patient. All right, so once my hand is here, I cannot move it. One side, pitch. One side, pitch. And down the middle. I'm going to go ahead and insert it in my patient. Take a deep breath. I hit urine return. I'm going to advance another 2 to 3 inches. Hold it in place. Now the catheter is in, I don't have to worry about being sterile. Go ahead and hold this. Insert my sterile water. Go ahead and gently pull back. All right. Now I'm going to place this on a non-movable part of the bed. Make sure there's no dependent loops. I'll apply a stat lock to the patient's thigh. Anita, I'm going to put this little sticker right here just to hold it from getting pulled. Leave enough slack. All right, we're going to get you cleaned up. As far as documentation, I'm going to document date, time, initials of insertion, the size of the catheter, which is 14 French, and then I put 10 cc's in the balloon. We'll cover you up. Anything else we can get you, Miss Anita? All right, we're going to go ahead and lower you back down. Make sure you have your call light, and we'll be back around to check on you shortly.